Welcome everyone to the first of a series of the European African Health Summit to improve access to through telehealth. We're really excited to have you here today with a fantastic panel that's going to walk us through what it means to have telehealth that can be accessed through Europe to Africa going forward. We have today with us a great panel of experts who have already had experience in the region. And as we go forward, please, we welcome you to post any of your questions or comments in the comment or question box, and we'll be able to air the questions going forward. To lead us here today, we'll have a welcome by Dr. Amit Thakur, who is President for the Africa Healthcare Federation, and Dr. Brian O'Connor, who is Chair of the ECHA Alliance. We have chief guests with us today, which is Gabriela Fessus and Bakari Hardy Nyari of the African Union. We would like to welcome the welcome speech by Dr. Amit Thakur and Dr. Brian O'Connor. Thank you.
Thank you, Myra, and thank you to all the attendees for spending some time with us on this very important subject, which is telehealth. And improving access to telehealth is top of the mind on many people's and many ministries of health across Europe, Africa, and indeed the globe. The pandemic has actually positioned us very well, and the explosion of digital health has been seen across the world like never before. What has also happened is that the number of partnerships that are growing in digital health have been phenomenal. Every player in digital health has realized the synergies are actually creating more impact when it comes to affordable, quality, accessible care. When we talk about digital health, the spectrum moves right from solutions to payment mechanisms to logistics and including access to care with professionals. Today's subject is going to be specifically on telehealth, and it'll try to bridge the geographical divide, and I also hope the financial challenges that this will bring. For far too long, many people have thought digital health does not only provide maybe interesting solutions, but it adds cost to doing care. So the health workers have been reluctant in embodying digital services in their practice. But in the last 5 to 10 years, the paradigm shift on digital health has shown us that not only you can get good quality, but you can get better access and you can make an impact on affordability. The ministries of health and the leaders at Africa Union and European Commission will tell us a little bit more about also the concerns about this explosion of digital health when it comes to regulatory practice and when it comes to appropriateness. So the skepticism and the reluctance you all must have witnessed when you explore different markets in your own continents and in your regions. And this skepticism is very necessary for us to find the right solution at the right place with the right partners in the right manner. The fact that we have great enthusiasm from the attendees that have joined us from far and wide, Africa and Europe, shows that there is a need to accelerate access through telehealth. I do want to thank ECHA Alliance, who partnered with us at Africa Healthcare Federation. My board, my management, and the members from 27 countries in Africa are very delighted and thank ECHA for stepping forward in coordinating this joint webinar. Our intention is to spark a dialogue, but eventually have an action plan so that we can follow up some of the interesting suggestions and ideas onto a series of roundtables and action items that can see stronger partnership. So we go from talk to action at the end of these 90 minutes. At this point, let me invite my partner from the Europe continent, Brian O'Connor, who is the chair of ECH Alliance, to give his remarks before we jump in with the speeches from our chief guests and then to the panel. Brian, the stage is yours. Over to you.
Thanks very much indeed, Amit, for that introduction. I just reflect on this. This is the first summit we're having between Europe and Africa. Amit and I absolutely agree that there is a need for action to follow these things up. We all attend so many Zoom meetings a day that you sometimes wonder you're going simply from one to another and ticking a box. We in the Alliance have developed a network throughout Europe, a very substantial network, and then the globe, to ensure that all the good talk, and you need to talk, but sometimes there's too much talk. And I'm a great believer in doing. So we learn by doing. My only reflection on telehealth is this. This is the first of a number of subjects, but I started working in telehealth, believe it or not, 15 years ago. I also smile when I see during COVID, people coming up with telehealth solutions, which by the way, are the same technologies which were used 15 years ago. So one of the things we've got to break through is the question of procurement, people's understanding of what telehealth can do. And I think that's just a part of a process which together we can do. The last thing I'll say is this. This is what I would call the digital health age. Now, I've been in this for 20 odd years. The obstacles put in front of us, by well-meaning people, pilots, trials, God, have been on forever. You get to the stage where pilotitis became a disease in itself. Now what we're recognizing is in a crisis, you have to respond. People have responded magnificently and proven that tools such as telehealth are fundamentally not only here to stay, but in my view, are just the beginning of what they can do in terms of a better healthcare system for so many people. So I'm really looking forward to hearing this, and I'm really pleased and thankful to all of the speakers we're going to hear from. Oh, back to you, Amit.
Thank you so much, Brian. Action is the word, and we have really two chief guests that we are very privileged and proud to have with us, who are going to set the stage. We have from European Commission, and we also have from the Africa Union. I will invite Bakari Nyari, who is a leader at the African Union Commission, and he will give us more of an overview of what he thinks are the key messages from telehealth. We are going to give each one of our 6 speakers about 5 minutes, and then we'll open it up to an open forum and Q&A. So we will ask to invite to stage. Please welcome Bakari Nyari. Thank you, Bakari, for your time. Bakari joins us from Addis Ababa. And as you know, Africa Union Bakari has been in the forefront of dealing with the pandemic since it broke last year. And telehealth has been a matter of discussion. And I know you have an Agenda 2063 that spells out the importance of the private sector and the importance of telehealth. And in there lies a few challenges. Here are attendees who are serious in moving the needle on telehealth. Let's hear your message. Welcome, Bakari, to stage. Over to you.
Thank you very much. So the COVID-19 pandemic has increased the need for digital health with border closures, strict movement of goods and services for healthcare, and the need to access information and documentation on health status of individuals using non-physical movement. Digital health can improve healthcare by increasing access to healthcare services, bridging distances, and enhancing the experience of receiving and delivering care essential to hard to reach and difficult areas. Digital health cards and other digital services such as telehealth reduces the need for physical restriction and other barriers that limit healthcare delivery. Digital health is going to be the way of the future if health systems are to be strengthened. The 36th ordinary session of the African Union Executive Council, held from 5th to 7th February 2020 in Addis Ababa, endorsed the digital transformation strategy for Africa. One of the critical sectors of the digital transformation strategy is on digital health. Digital health shows great promise in supporting health systems transformation. Positive trends include greater recognition of the importance of digital technology and the need for government leadership, reduced barriers, especially in the availability of mobile devices, including smartphones, decreasing hardware costs, and better network connectivity, and a clear focus on integration and interoperability of digital health solutions, including the importance of standards and a focus on scale and increased awareness of the need for harmonized approaches. Under the leadership and the coordination of the Department of Health, Humanitarian Affairs, and Social Development, and the technical support from the Department of Infrastructure and Energy, as well as coordinators of the digital transformation strategy, the African Union plans to develop a continental digital health strategy with an implementation plan for consideration and adoption by member states. To this end, the African Union Commission shall conduct a baseline assessment of the use of digital health technologies in Africa to inform the development of a digital health strategy. Also, to develop a continental digital health strategy with an implementation plan for consideration and adoption by member states. And finally, to develop policy guidelines on the use of digital solutions and tools to combat pandemics such as COVID-19. The implementation of the strategy, both Department of Health, Humanitarian Affairs and Social Development, and Infrastructure and Energy would periodically engage with partners and stakeholders to scale up the advocacy on the development and implementation of digital health. The two departments will promote networks by bringing together the global digital health community to discuss the use of digital technologies to support early warning disease surveillance system, better preparedness, and better response to health emergency. The African Health Strategy's overall objective is to strengthen health system performance, increase investment in health, support research and development of vaccines, medicines, and technologies to address both communicable and non-communicable diseases towards improving equity and addressing social determinants of health to reduce priority diseases burden by 2030. The African Health Strategy outlines key policy frameworks, accountability mechanisms, including strengthened health systems to sustain the gains in performance to enable achievement of the universal health coverage, whilst ensuring strong leadership and governance among member states to achieve the following. One, to strengthen the capacity to sustain, integrate, coordinated, and collaborative research, innovation, and translation for digital health. To develop and implement sustainable mechanisms for investment and financing in research and innovation to improve primary health care through digital health technology, and to generate new knowledge aligned to health goals and targets, and advocate for translation into products, services, policies, and processes to improve health, and to strengthen data sharing platform and system to optimize digital health delivery, and finally, to advocate for the adoption of emerging digital health technologies, supporting platforms to improve healthcare. Thank you.
Thank you, Bakari, for that wonderful overview on the African health strategy and the importance of digital health and the journey it will help us with when we go towards universal health coverage. There you have it from the AU, the apex body that we all in Africa are working very close. Our next speaker and the chief guest, who we are very delighted to have with us, is Gabriela Jesus, who is the head of Unit Social Inclusion and Protection, Health and Demography at the European Commission. Gabriela, it's a delight to have you here as a partner. The floor is yours. Talk to us what is on top of your mind when it comes to improving access through telehealth and the role of the European Commission. Welcome, Gabriela.
Thank you very much. Thank you very much, Mr. Tucker. And I would also like to warmly thank ECH Alliance, Brian O'Connor, for the invitation. It is my honor to be with you today. I come from, indeed, the European Commission, the Directorate General for International Partnerships, which is part of the European Union's external relations. And we have been at the forefront of the European Union's effort to implement global commitments, notably the 2030 Agenda of the United Nations, Nations and the Sustainable Development Goals. In fact, our Directorate General even changed its name. It used to be DG Development, and now it's DG International Partnerships, to precisely reflect the importance of partnerships in our approach. And of course, as a unit dealing with health, access to health is at the core of our commitments. And we have been redoubling our efforts in the light of the pandemic to strengthen health systems and collaborate on the achievement of universal health coverage in partner countries. And also, of course, the pandemic has strongly reminded us all of the importance of health access and its consequences for other sectors. It also created an unprecedented momentum for digital health, increasingly recognizing it as an enabler to overcome health systems bottlenecks. Beyond the urgent needs for COVID-19 deployment, access to health services, notably through telehealth, remains a key component towards achieving universal health coverage. Now, currently, we are in fact in the middle of programming the funds for the next 7 years with our partner countries. And there is a strong emphasis which is being given precisely to digital transformation and its opportunities in key sectors such as health. And here again, we see the importance of partnerships in our approach, and we share this common mission with the Africa Healthcare Confederation and the ECH Alliance of connecting the dots between key stakeholders. And let me give you a concrete example of our commitment and also opportunity for collaboration is the Digital for Development Hub. This is a hub which was launched in December 2020 with the aim of promoting new international partnerships on digital transformation. And through a Team Europe initiative, as we call it, we are joining forces between EU institutions, but also with member states, and advancing multi-stakeholder dialogue outside Europe. So notably with partner countries, with the private sector, civil society, or state actors, to ensure that there's the best leverage of their expertise, resources, and that we share best practices. And as the so-called D4D, as we call it, the hub's first operational regional component is in fact the African Union EU D4D hub, which aims to advance new digital partnerships and investments for a fair and inclusive African digital economy, which really calls for unprecedented levels of coordination and continued multi-stakeholder dialogue, and the necessities to scale up investments and impact. And this D4D hub is certainly a key enabler for digital health through promoting partnerships, sustainable transformation, but also data privacy, and to ensure that people are at the heart of the digital transformation. So I really think that at the European Commission, we are at the key moment now, programming the funds for the next cycle. So we really look forward to our future collaboration, and we commend you for the organization of this important webinar and for your continuous work to connect the dots between the digital health stakeholders. Wishing you all the best for the webinar. Thank you very much.
Thank you so much, Gabriela. You hear it now from the international partnership leader and the policy champions. Gabriela has given us the D4D hub. We are going to definitely look at it. It's just new, December 2020. I hear that from you. Bakari has also painted a very good picture of what Africa Union is doing. Bakari, you also getting questions on NCDs from Tanzania already coming up. And I'm going to come back to you, Bakari and Gabriela, on policy matters soon. But before we do that, at the Q&A and open forum session, let me now move on to the panelists who now, having heard your policy, are going to give us their examples on what's happening on the ground with telehealth. We have 4 fantastic panelists from Belgium, Scotland, Kenya, and South Africa. So we have 2 real examples from Africa and 2 really on the ground examples from Europe on what partnership is all about and what their experiences are. I will ask them to introduce themselves and reflect on this webinar and share with us what they are doing in their countries and in their regions and what is their ask. So we will also give 5 minutes to each, And I will first like to welcome Dr. Charles Kamotho, who is the founder and CEO of Daktari Africa, based in the Silicon Savannah, Nairobi, Kenya. Charles, it's great to have you on this panel. And let me invite you on stage and share with us your key experiences. Charles, welcome.
Thank you so much, Amit, for that very kind introduction. And hello, everyone. I would like to begin with a small story as I share my screen. I recall a few years ago, actually, this June last year, a patient called Mary woke up in the height of the COVID-19 pandemic. And she's a 70-year-old lady. She woke up with pain in her right knee. And she's a known diabetic and hypertensive on various medicines. But she hadn't seen her doctor for some time and she needed medical attention, but was afraid of visiting a health facility or boarding a means of transport due to the COVID-19 pandemic. So her son knew about Daktari Africa and organized for a video consultation on his smartphone from her home in Western Kenya, several hours away from Nairobi, the capital. So I saw her online, recommended some tests and from a local lab, and we had some medicines sent over to her. She paid using M-Pesa, the mobile money platform. And we had several such consultations until last January when she finally opted to travel for a face-to-face visit and also for cataract surgery, which she needed. So by then, due to the consultations, her blood pressure, her blood sugar were well controlled and her pain was much reduced. And she has continued on quite well. So this is one example of Daktari Africa telemedicine and what it can do. So telemedicine in Africa is very young. Indeed, Daktari Africa is the first patient-centered telemedicine platform in East Africa and is only 12 years old. It's a little younger than Brian's, as he mentioned earlier. But since then, we have seen the growth of many others on the African continent. So with 16% of the world's population, Africa has a disproportionate
Okay, we seem to have a telehealth glitch, maybe from one of the panelists. And I do want to find out if Charles is going to get back onto the platform. And if he does, and I can see him back, you can carry on from the second slide. Not a problem, Charles. We heard the story, and
Yes.
you are on the second slide with some good data. Please carry on. Amazing.
Thank you very much.
Welcome back.
So hypertension is common, underdiagnosed, which leads to many complications, such as kidney failure, heart failure. The doctor-to-patient ratio in most countries in Africa is below the minimum recommended, as you can see in the slide. The majority of Africa's population is rural, yet most doctors live in the urban centers. And comparatively little is spent on healthcare in Africa, while medical health insurance penetration is less than 10%. Offering an opportunity precisely for the health insurance industry if we get the model right. So all this is perfect ground for telemedicine. It's an opportunity for us. 30% of Africa's population lives 2 hours or more away from a health facility, which makes it less likely for them to physically visit, especially for those conditions with few symptoms, such as high blood pressure precisely. Again, Africa has a young population that is both tech-friendly and tech-savvy. And by 2050, half of the world's population, half of the world's youth will be youth in Africa. So the market is large. There is need for more mental health care for the youth, especially with the current pandemic. We're seeing that daily. And actually, Daktari Africa is developing telemedicine tools for mental health, just as for the NCDs, which we're talking about. Mobile telephony is on the rise. This week, Safaricom, the region's most profitable company, has just moved into Ethiopia, and we hope telemedicine will grow as well in the region. So the future of telemedicine is bright in Africa. The pandemic has seen the uptake of digital health globally. Its use in the US has grown from 11% to 46% in 1 year. And it is projected to become a $250 billion industry. More and more doctors are adopting it. And in Africa, the total expenditure on telehealth is expected to rise 5x from 1.5 billion US dollars to 7.5 billion in the next few years. So as I conclude, let's just realize that to get to that bright future, we need to create the appropriate environment that promotes innovation and success in telehealth care. The right laws and policies will regulate and protect the stakeholders in telemedicine, namely the healthcare providers, the patients on the other side, the ICT players in the middle, and the third-party players. Insurance companies need to innovate. We are seeing, yes, online policy applications, but the companies need to create more micro-insurance products. And this will be possible because telemedicine will help manage and reduce the risk of hospital admissions, which will reduce costs. So Daktari Africa was actually endorsed by KPMG in 2017 precisely for this. The ISPs, the internet service providers, need to ensure widespread, stable, and strong internet signals to ensure proper user experience, including in such webinars, free from interruptions. And the right business models are required to ensure improved patient outcomes as well as business sustainability. So the price of the consultation or of the service needs to be affordable for the patients, and yet should also be attractive enough for the caregivers to remain committed. So big pharma, regional and governmental organizations, NGOs and impact investors can play an important role in this to take telemedicine to that higher level of efficiency. So just like the pharmaceutical industry for hypertension was very young in the 1950s, it has exploded to become a multi-billion-dollar industry in just a few decades. So can telemedicine, and even faster today. Thank you very much.
Thank you so much, Charles, for that wonderful presentation. And to all the attendees, if this is not going to convince you, what Charles has nicely framed, you know, there'll be very few other points that will convince you that Africa is ready and the partnership between Europe and Africa is now well positioned for telehealth. I like the fact that you talked about the ratio, doctor-patient ratio, which is very small, which is where telehealth comes in. I also like the fact that you talked about legislation. And Bakari, you know, you spoke about that as well. Having the enabling environment with the right licensing in place will actually spur growth. And you also touched, Charles, on who's paying. You can have a nice product, but then you don't have people being able to pay, and then you hit a glut in
Absolutely.
your financials. I'm coming back to you during the open forum for more questions. Thank you, Charles, for that. I'd like to now move very nicely to our next panelist, who joins us all the way from Brussels, Belgium. Emmanuel Blinn is the founder and CEO for Tech Care for All. It is a company which we'll hear more about, but is present in both Europe and Africa. And I've seen Emmanuel's company doing a lot of work in the African space, and here to tell us more about his experience, please welcome Emmanuel on stage. Over to you.
Thank you very much, Amit, and thanks for having me on that session on access and how telehealth can improve access, which is basically the reason why I'm sharing my screen now, which is basically the reason why I created Tech Care for All. 3 years ago, it's really started in Botswana, Gaborone. At that time, I was the chief commercial officer of Bristol Myers Squibb, and I was visiting on behalf of the foundation of a company, a pediatric oncology ward in Gaborone, an aspiring pediatric oncology ward in Gaborone. And I was with someone preparing a chemotherapy in the kitchen of a ward, and I was asking her, when is the last time you were trained? And it was more than 5 years ago. So I said to myself, you know what? I mean, there must be new ways with the digital health revolution. There must be new ways to actually ensure that healthcare professionals, nurses, community health workers, doctors get their proper continuous medical education. And then if I move forward, but I'm still 2 years ago, before COVID-19, you know, the way people were trained, whether they were trained by pharmaceutical companies, by governments, by NGOs, by hospitals, people were put in a room with a trainer who was dispensing training, and then people were going back to where they were working. And if they did not have access to that kind of training, then there was really no continuous medical education. And there is very strong challenges in monitoring, in checking, in certifying, in making sure that the training is really continuously happening. So I created Take Care for All. We have operations in Kenya, in Nigeria, in Senegal, which are covering the African continent and the different languages, cultures, markets, specifics. And then we have operations in India as well, but I will focus on Africa for today. And really what we have seen over the last 18 months is an amazing shift. I mean, a shift that has happened at a speed that nobody could actually anticipate with COVID-19, where suddenly HCPs moved to online for continuous medical education everywhere. And especially in Africa and in India, we have seen a big surge of online education happening. And what is very interesting is that it's here to stay. And that people, HCPs now, healthcare professionals are all saying, you know, we want to continue with some sort of hybrid learning, where it will be a mix of accessing continuous medical education content online and offline. So this has totally changed in a matter of really weeks. So if you look at our company, we have created in January last year, we have created a marketplace. So January 2020, just before COVID hit Africa, we have created a marketplace for online training of healthcare professionals, where whether you are an NGO, a pharma company, a medtech company, a government, a teaching hospital, you can put content online, whether it's a webinar, an e-learning session, and you can disseminate that content all over Africa to healthcare professionals. And this content is coming now mainly from Africa, and I'm very proud of it. So we have teaching hospitals, we have African companies, organizations which are putting content online, but this content is as well coming from the biggest academic centers in Europe or in the US, or from major healthcare organizations outside of Africa. And so anyone can put content there, and then any healthcare professionals can access this content online, register. And so we started really January 2020. We now have like more than 75,000 users who have registered and who are continuously going back to the platform in a matter of weeks. I mean, really, this has happened. And when you think that there are roughly probably 1.1 million doctors, Africa plus India altogether, but nobody is really sure about that number, but let's say it's the number. We already have like almost 10% of the doctors who have registered on this marketplace. So incredible development. When you think about the future, there will never be fast enough doctors, enough nurses, enough community health workers in Africa. This population is growing, but it's not growing nearly as fast as it's required to reach UHC and SDG 3. So the need to really make sure that the scarce resources we have are properly trained on a continuous basis is immense. This need is absolutely critical. So, and online, because of COVID, online will now be part of the equation in a very big way. And we can reach populations of HCPs that could not be reached before because of online, because they could not travel to training centers in big cities, in university hospitals, etc. So that's the same like for patients not traveling the 2 hours to see a doctor. And so we see a big future for hybrid models of continuous medical education. And the call is really, it's a marketplace, you know. So if you think at booking.com, you can book a Hilton room, but you can book as well a room in a very small nearby hotel. So the call is, you know, whether you are an NGO, whether you delivering content for healthcare professionals, a pharma company, a medtech company, a government running a program for your professionals, a university hospital, a key opinion leader, an expert yourself, go there, look at how it can look like for you to reach more people, impact more people with the knowledge and the skills that you can disseminate. Thank you.
Thank you, Emmanuel. That is really good because 10% is a very good number. And I'm hoping that the leaders I see who are attending today's forum, they belong to many of the medical associations in Africa. And through these doctor associations, if you get more of these doctors onto the platform, you will probably have a robust number of healthcare providers and nurses and clinical officers and all the other cadres which are frontline. Thank you for sharing that. I really like the fact that the content is being placed from all different sources. And I'm sure you have a mechanism to make sure false content is not online when we put everything that's available. So I'm going to come back to you on that discussion on quality that comes through. Thank you, Emmanuel, for sharing. I would like to now move back to Africa and one other vibrant country that you all know and is very strong in the continent is South Africa. And in that country, Sharon Ahmad, who is the founder and CEO of Recomed, has begun and is expanding his services so that he can make an impact on telehealth. Here to tell us more about this is Sharon. The stage is yours. Welcome.
Good day, everyone, and thank you, Amit, for that introduction. I'm the founder and CEO of the health tech company Recomed, where we're South Africa's largest and fastest growing online healthcare booking platform and marketplace. So that's a lot like an Airbnb, a booking.com, or an Uber-like model for doctors. And very simply put, what marketplace platforms do is matches consumers with service providers. So we've got about 1 million to 2 million South Africans searching for healthcare services on our platform, Recomed. And they come and they connect with, they find and they book appointments with about 3,000 doctors and clinics on our platform. And how we've been able to create the service over the last couple of years is, of course, we built the tech, but the secrets to what we did was to integrate our technology with 90% of the practice management software market that was active in the country. And that allowed doctors to work from a single system with a synchronized workflow across, from their electronic diary to their Recomed platform. Now, what I thought I'd share with today is really what our experience has been over the last sort of 15 months. Now, I'm reminded when I think about the last 15 months of this famous quote where it was said that there are decades when nothing happens, and there are weeks when decades happen. And certainly, as we found ourselves around the beginning of April last year, moving into a hard lockdown, it was one of those weeks where decades were happening. And I'll give you an example. We, at the time, were a healthcare booking platform. We had thousands of practitioners. We'd be doing around 55,000 online bookings a month in March 2020. By the end of April 2020, we were down to 24,000 online bookings. So in a month, doctors around the country, on average, lost 50% of their walk-in patient traffic. And we saw that in our business. Similarly, there was a telehealth boom in the country simultaneously. So in South Africa, it had previously been against the regulatory body's guidance, and they banned telehealth consults and video consultations as a legitimate form of medical consult that could be reimbursed by healthcare insurers, etc. This was not allowed. Within 3 weeks, after 10 years of lobbying, within 3 weeks, they published new guidance, the HPCSA, which is the body, saying that this is allowed, and they actually made it a very relaxed regimen. It even extended beyond a patient having to do a video consult with the existing doctor. They could actually do one with anyone. And this for us was unbelievable progress. And I suppose it goes to show what external factors can do in creating disruption in a sector. So that was 10 years of regulatory evolution in a handful of weeks. What we saw beyond that, my company built a telehealth platform where we simply worked with Amazon Web Services to couple a video consult solution on top of the online booking. So when a patient logged onto the platform, recomed.co.za or recomed.com, to go and book a doctor or find and book a doctor, they can simply add a video link, and then the doctor and the patient can connect over video from their phone. And this got some growth. But we quickly saw about a dozen different solutions, at least 12 solutions, rapidly enter the market, of which I would say half were homegrown in the country, and half came from overseas, from India, from the UK and other markets. And the doctors, as in any market, adopted a variety of different solutions. So we then evolved our platform and said, look, if a doctor is particularly tied to solution A, or a corporate group or clinic group is tied to solution B or C, let them use it. And then we went on a journey of integrating with a variety of different solutions. So we're an agnostic platform and allow a patient to book a telehealth consult with the doctor, and that will fire up whatever tool the doctor wishes to use. One of our largest partners in the region is Discovery Health, who are the largest healthcare insurer in the region. And they integrated their digital platform with us, and we are able to power a lot of bookings for their digital health platform as well. So we also saw innovation from the corporate side of the market as well. And in terms of numbers, I use that statistic of 55,000 online bookings. So our business over the last year, since recovered, we're doing over 60,000 consults a month. But I think that the market themselves, the average doctor, due to the fear around COVID, is still seeing fewer patients on average than they did before March 2020, because online bookings have taken up a greater share of the bookings pie in general, because people want to book online so they don't wait in a waiting room that's perhaps too crowded, etc. We're seeing around 5% uptake thus far in terms of total volume into telehealth bookings. Now, for us, this is staggering, because for every year until the prior year, this number was 0.0%, maybe 0.001%. We've seen that jump up to 5%. I would estimate that this number is going to triple every year, or double for the next few years, and level off somewhere around 30%. But we're very excited to see this growth. And I think it goes beyond just video consultation. So that's where things started. But what we're seeing now is new innovations that we're taking to market, as well as other players, such as digital pharmacies, where patients can simply order their chronic medication and have it shipped and delivered to their door on a consistent basis without having to get up and go walk into the pharmacy queue and so on. We're seeing a proliferation of patient monitoring tools. Suddenly, patients understand all of a sudden that perhaps their doctors want to track their healthcare markers. They're a lot more willing to engage and wear wearables and track this data and input it into a health record, which they share with the doctor. And in addition to that, we see innovation, of course, the doctor end and the insurer. I think that traditionally, and I think Charles mentioned this in his presentation, but traditionally the doctors were the laggards in the healthcare sector from a technological adoption perspective. And I say this with love, because I'm a computer engineer, but my parents are both doctors. So I really say this with love, that they're generally slower adopters of tech. And in South Africa, the median age of a GP is 55 years old. And I find that the 15 years between 40 and 55 can make a big difference in a technological adoption for the average market. But I found that what can only be described as a total shock to the system, has suddenly changed their behavior in a very dramatic way, in that whereas before innovators like us were pushing technology into the practices and having to convince them how we could help them, we are now being called, there's now a mutual understanding of this could be valuable. this could help us. And I'll just close on the point of the consumer. I think we must agree that there's a massive proliferation of both telecoms infrastructure, but also smartphones in people's pockets. And when we have a system like that, and particularly when we have more nurses than doctors, and we can empower the nurses with a video link to a doctor or the patient with a link to the doctor, I think it's absolutely inevitable that telehealth and all of the different products and platforms associated to it dramatically increase the access to care, the delivery of the care, and drops the price of the care. And I think that's something we're all really looking forward to. Thank you.
Thank you so much. I think that data is so incredible when you talk about 0.01% going to 5% and then 10. You nicely sort of plateaued this business in this space at about 30%. And that's quite voluminous. And it's a big ask, and letting the laggards know that at least 30% of what you do might happen if you know how to click and do connectivity. So I think the pandemic, like you said, has given us a lot. And one of the things it's given us is a opportunity in the crisis. So within weeks, decades happen. So you've actually said the pandemic brought policy changes that it didn't do for 10 years. I'm going to come back to you, Sharon, on conversations around the 30%. But it's really a great pleasure now to jump back to Europe in a country, Scotland. And Margaret Woriski is joining us as the head of technology, enabled care and digital healthcare innovations. I think this is going to be very interesting to hear from her what they have been doing and share their experience on improving access to telehealth. Margaret, it's a delight to have you here. And I know that doctor stands for a medical doctor. And yes, we've heard that doctors were scared of technology. They prefer the stethoscope to the keyboard. But tell us more about this. Welcome, Margaret.
Yes, no, thank you very much. I'm delighted to join this this seminar, and I've really enjoyed listening to the panelists and the speakers. And there's so much similarities, I think, in what we're doing and opportunities to share. So I have a few slides, so I'll just go through these very quickly. So just to say a little bit about the work and the program that I do, it's really focusing on looking at how telehealth can enable a shift for health and care systems from crisis intervention to more preventative, early intervention, enablement, and self-management. And obviously in COVID, we saw it provided us, even though it's been very challenging, but it has provided opportunities to look at accelerating the mainstreaming of some of the services that were really at a fairly early stage of adoption across Scotland. However, it also identified some gaps in our digital services and skills that we will need to address. So the slide here just shows 4 key points I wanted to make in terms of the programme of work we've been taking forward in Scotland, and what I see as some of the fundamental sort of rationale for it. So first of all, it's about creating conditions at a national and a local level to facilitate that deployment. And we did that by providing a range of national support, but also providing some dedicated funding to local health and care organisations. Cross-sector leadership and collaboration is a second point. So in Scotland, we work in an integrated health and care system. So we try and focus on the citizen and look at what the range of health and care and support services. So having that strong sector, cross-sector leadership and collaboration has been really important. We have a term that we use in Scotland called Once for Scotland. Now, we are a population of just over 5.5 million, so relatively small, but we have quite a diverse country, rural and remote areas as well. And we have a view that if we can get something to work in one part of Scotland, that we should be able to transfer that to other parts of Scotland. And that helps by reducing cost. It allows us to do things at a national level, but recognising there will be local context and circumstances. And the fourth point is about having a cross-centre excellence and expertise, building capability. The next slide. These are some examples, and I was really fascinated to hear some of the work that Charles was talking about as well. So just showing you 4 examples here of what's happened in the last year around Scale Up. The first one is around our video consulting in Scotland, a program called Near Me. In March 2020, we had approximately 300 consultations a week, and we moved up to sort of in the region of 22,000 a week. We had a dip over Christmas and New Year, but you know, it's beginning to sort of stabilize off, and we feel there's a lot more that can be done there, but a huge increase in video consulting, as others have also spoken about. The second slide again resonates with something Charles was talking about in digital mental health. So we have a range of services that we offer, and this chart shows a 4-fold increase in referrals for digital mental health services in the last year. Moving to the bottom half, we've got our Scale Up Hypertension self-monitoring. Again, we've heard about the importance of managing blood pressure and hypertension, and this program was underway before COVID, and we now have accelerated that. So we've got over 50% of all GP practices in Scotland using remote monitoring to help diagnose and manage people with hypertension, and a lot of evidence to support the efficacy of that in terms of long-term health benefits. And the fourth one is an important area, because this is focusing on digital inclusion. So as we move to more digital approaches and tools, we need to be mindful of ensuring that our citizens are digitally included. And this visual shows work we did with our residents in care homes, a very vulnerable group, and particularly vulnerable during COVID. So we've had a big focus on facilitating residents in care homes to be digitally included by providing devices, providing sort of data where that's relevant, and skills support. And we've covered up to 91% of residents now in care homes that can help them access a range of services, as well as engage with family and friends. But I think I would like to emphasize the importance of digital inclusion. And my final slide, just by way of summing up, is in reflecting on what are the conditions to support Scale Up. On the one side, we've got policy. So we need to have that sort of mandate, that authorizing environment that facilitates the use of telehealth in the way we design and deliver our services. And the second one is about that wraparound program, which, you know, helps move things through an innovation pipeline, early tests of change, moving to early adopters, building in improvement support and change management, and importantly, drawing out the evaluation and the evidence as we go along. So that's a very quick run through some of our experience in Scotland, but look forward to the discussion and conversation going forward. Thank you.
Thank you, Margaret, for sharing. It's very clear. I think your graph was very powerful. I think you probably showed us the trajectory. And if a similar graph was shown to us maybe 5 or 10 years ago, it would be a different picture totally. And so I think you're also telling us that there has been a recent upsurge on the kind of work that you've been doing around the telehealth space. Let me thank all the panelists and ask them to come on stage and switch on the cameras, because I'd like to do a little bit of a Q&A and wrap up, and Brian will support me on this. There are some Q&A questions coming on the side panel, which you can always answer if possible. And what I'll ask Brian to do is, if we don't get a chance to field those questions and you find that's an important question, Brian, feel free to pick that up. But I'll move around with the panelists first before I come to Bakari, and really talk to Charles. And Charles, be honest with us. Where's your biggest, stumbling block? I saw lots of data, lots of statistics, but the movement, I see graphs from Scotland, I see things. I see Sharon also shared with us some numbers, but there's something that's really bothering us to get that inflection point. Is it cash? Is it regulation? And what is your key ask as you make your final comments? Charles, over to you.
Thank you so much. Well, you've actually nailed it, Amit. So indeed, it's cash has a lot to do with it. Cash, as far as building sustainable models of care. As far as legislation is concerned, that's getting into place. Actually, I'm privileged to be part of the group that is actually coming up with an adaptation of the digital or e-health bill 2020. And so when it comes back to that issue of sustainable models, I would like to just perhaps share this slide, which we were very privileged. This is a slide of a presentation we made at the European Society of Cardiology 2020, where again, we had a pilot, we made a pilot thanks to a grant from Pfizer US, where we actually showed that telemedicine is effective even in the rural areas. And we want to move now to the next level where we can actually make that sustainable. And this is where now this model of healthy at home comes in, where we create sustainable models where the price is just right and where we can actually scale up. We do have a very successful self-sustaining model, which is the well-being at work, where we look at corporate clients. And that's been going on for 3 years, so even before COVID. And we work very closely with insurance companies. So that model is doing well. The issue for scale is the rural model, where the larger population lives, because that's a low margin and high volume sort of area. And so we're looking at that, and our ask really is to partner with organizations such as those represented here. We already have a number of partners, but we want to take this to the next level. We want to take this to East Africa. We want to take this to Africa as a continent. And so we're looking at partnerships to enable grants. Grants are very welcome because they enable the company to grow while allowing healthy shareholding that will keep the vision and the mission of the company intact. It's very easy to focus on profitability and to lose track of the whole game. We're also looking at impact investors. Those are very, very welcome. And we already have a couple of them. We have an impact investor in the name of AFSA Capital and also an angel investor. And Microsoft for Africa came on board after one of our awards in South Africa. And also the added value because of the HIPAA compliance. So that's our ask, Amit.
Sure. I think the ask is very clear. Brian, I'm going to come to you after Emmanuel before I go to Sharon and Margaret. But, you're at the right platform. Brian will tell you about connecting the dots. You are at a place where partnership is going to flourish. And that's why we started this webinar. You're at a place where investors will come through. And you're at a place where Africa Healthcare Federation and ECHA are both apex organs that want to try and facilitate. So your message is clear.
Thank you.
Emmanuel, coming to you, and that's really good. Get everybody on board. And doctors, we've been hearing about the laggards and the story's been happening. And to get 75,000 or 240,000, the numbers you have, you want the numbers to go up. You're giving good content. I'd really love to go and see the platform and look at the content. I do want you to give me your ask. I feel that your challenge must be getting the right doctors on this platform to actually do the right thing, also by learning and telling everybody, this is my Hutchison's in my pocket. We as doctors, we used to carry that book in our lab white coat. And Charles, you remember that book? So that book now has become the platform Emmanuel is trying to tell us. So yeah, be honest to us. What's the issue? Where is the challenge, and what's your ask?
Yeah. So I think you made very good comments, Amit, which demonstrate that you actually know the field on the ground, and especially about the role of medical associations. So here I'm just sharing a map of our reach in Africa by different subregions on the continent, and what you have in light velvet is the reach we have through medical associations, and clearly medical associations are the key stakeholder in bringing healthcare professionals online for their continuous medical education. The good news is that this has happened. We have most of the medical associations on the continent on board. And so through them, we can today reach more than 70% of doctors in Africa. So reach is not the issue today. Okay. The issue is the fact that, remember the early days of the web. Hilton, Sheraton, they were all busy building their own websites.
Yes.
To enable people to book rooms online.
Right.
And nobody wanted to put their rooms on booking.com.
Right.
And then everybody moved there. at some point. So this is what needs to happen in healthcare. Today, every pharma company, every NGO, every government, every medtech company, they are busy building their online continuous medical education proprietary website. Mm-hmm. And so the speed at which they realize the value of a marketplace, where from a doctor perspective, you can access in 2 clicks content from a lot of different sources of high quality, public, private, for-profit, non-for-profit. The value of that for healthcare professionals is immense, from a credibility standpoint, from a reliability standpoint. The value for the content provider is immense from a reach, cost, efficiency perspective. How many people you can impact and reach through a marketplace is much bigger and faster than with your own website. So that's really the question in terms of speed of scale, and speed of scale for us, and for speed of impact in terms of how we can enable HCPs across Africa to access high quality content. The speed will depend on how fast, and that's our job, on how fast all stakeholders, from pharma to medtech to NGOs to government to university hospitals, the speed at which they see, and we help, and through quality of the work we do, we help people see the value of a marketplace in this space, where you will have almost everything available in 2 clicks, whether you are a cardiologist, a community health worker, a nurse, you will have access to high quality content from different sources in a very user-friendly way. So that's the ambition, and we need all key stakeholders to really adopt. The good news is that some of them have already. We already have a few pharma companies, we already have the government of Kenya, we have a few NGOs, starting with Concern, or the biggest non-for-profit hospital network in India. So we already have those early movers, innovators with us. We now need to spread the message faster and better.
We are going to watch you and walk the journey. I think it's a process, and that process, we see Africa Healthcare Federation and ECHA at the center of that process. So you can count on us as we walk the journey. Brian, I'm bringing you midway before the end of Roundup. Just key points or issues from you.
Well, thank you. First of all, I think you all feel the same, that we often attend Zoom meetings and we hope they'll be over soon. Other meetings, you hope they don't end, because what comes across today is that it makes total sense for Europe and Africa to be working together. What's clear to me is I love how specific the presentations were. So I want to thank all of you. I don't want to pick on anyone in particular, but I want to thank you, Margaret, because we know each other very well. And I've watched what has happened in a small country like Scotland, population-wise. But as you said earlier, we should not miss the point. One of the points Margaret made was this: 2 points. One, there are both urban and rural areas, particularly the islands around, the lovely islands around Scotland, but they require a particular view, and many of those lessons could be transferred both to Africa and from Africa to Europe. Secondly, the other point Margaret made was that this question of telehealth itself is an old technology. I mean, just consultations, we look at us, we're all talking to each other on one platform. But what matters is how do you use it? What content do you put on it? What is a patient or a doctor able to do on it? So I think I regard telehealth properly done as a platform, not an end in itself. I see it as a foundation, a network, which is not properly exploited yet for wellness, prevention, and all of that. So that's just that. I was looking through the questions, Amit, while we were listening. And first of all, thank you for all the questions. I have to be honest, we go to some Zoom meetings and you never get any questions. So you have to make them up in advance and be ready to pretend there were questions. But in this case, we have lots of questions. One of the questions that come up, and I just want to address it in one sentence, is question of skills. This is fundamental to everything we all do. We know there's a shortage of people, there's a shortage of skills in people. And we in the Alliance are working with the Federation because we already run a skills program through our thematic ecosystem, Skills for Health in Europe. We want to extend that into Africa with partners such as the Federation. The last point, I don't want to take too long, Amit, but I want to say this. What this says to me is that you can see how we can move from here to the next time. And I'm not just talking about going from summit to summit. That's important to set the process. But already today, I can see where Margaret would love probably to talk to Charles and others among these speakers. There is information and knowledge you all have, which actually is really valuable. But if you keep it to yourself, I know you don't do that deliberately, but if you don't have the means to communicate, so please look upon the Federation and the Alliance as your means to communicate on specific, and even if you only have a content call between you, and we encourage you to talk to each other bilaterally, I think that itself creates a stronger foundation for the future. And I see Matthew Hine from the US posted a message asking about education of health officials, public officials. We've just gone through this in Europe, trying to educate procurement departments as to what's out there. Because it's not that they don't want to help. Sometimes they don't know what is available. So part of all of our jobs is to educate public officials and others in terms of what's in the market already. Why don't you tender for that? And the very last point you'll be pleased to know I'm going to make is on funding. All sorts of types of funding, but just to make clear, we in the Alliance have a project team. I see Carolina, our international project director, is on the call. We create consortia from our members. We then bid for funding from the European Commission, from Gabrielle and her team. But to do that, you've got to have, if I can put it like this, a foot in both camps. Think about it. We have a network in Africa. We have a network in Europe. If you combine the potential of those and then aim it particularly at specific calls, a combination of those may well see us being able to create some funding for some of the projects we'll all like to do. So again, practically, we'd be happy to help. Well, back to you, Amit.
Thank you, Brian. And I'm going to come back to you, and also I'll ask Myra to say a word or two as we round up. But let me move to Sharon. You know, I told you I'm going to come back from the 5 to 30%. And then Charles talked about cash. Who pays? If the insurance company is not going to pay for my teleconsult, whether I'm in South Africa or Botswana or Ethiopia, I will not go there, and I'll end up waiting. And so I think cash matters. Payment matters. Discovery, you talked about that. And I want to hear more from you. Are the insurance companies coming towards this? NHI in South Africa is rolling out. Or are people in insurance saying, this is a fantastic way for fraud, and this is what's going to put the nail in the coffin for medical insurance? Go ahead, Sharon. What do you think?
Well, you asked a few questions, Amit, and I'm going to answer yes to all of them. So there's competing things going on, and I'll give you a few examples again from the ground. So insurance companies, the healthcare insurers, and in South Africa, 80% of the people in the private sector have healthcare insurance. So that's about 9 million people, with about 41 million people with no insurance on the public system. So of those 9 million, they're certainly covered at this stage for virtual consultation with their providers. And fraud is a concern, as it is everywhere, but it hasn't prevented. And I've actually spoken with senior executives who are concerned about, I think the exact way that this executive explained it to me about providing a platform to scale fraud, if it could be a telehealth platform. So that concern existed. And we're still working our way through that. I think in general, we haven't seen huge abuse of that system thus far. And in general, at least the fraud can be limited to a family group, if there is such a thing, because they're going to be logging in and authenticated and so on by the health insurer. Now, all the health insurers have released tariffs to pay for telehealth consults, which again is an entirely new development, again happened in record time. And what's interesting, what we found is fascinating, is that there's a portion of the market that is very telehealth aware and trying to become telehealth centric and operational and offering that to their patients. There was another portion of the market that around the first couple of months post lockdown last year became telehealth adopters. And we see this all on our platform. We've got thousands of doctors, and they started switching these profiles off and saying, switch it off. And when we asked them why, they said, well, you see, we get paid more by the health insurer for a physical consultation. So we do not want telehealth appointments to cannibalize our physical consults business. So the truth is, this stuff is still shaking out.
Yes.
In the end, I think the technology is going to win because it makes life a lot easier for the consumer ultimately, and it drives down their cost. And the health insurers enjoy it because it also leads to reliable outcomes while driving down overall costs. So I think it's inevitable, but this behavior from different segments of the market has been interesting to watch, and it's all still playing out. Why I say 30% is simply because if I look to France, and similar companies such as Recomed, such as Dr. Lieb in France, they've been reporting around 30% uptake in telehealth. Now, we're a lot smaller, so I think we can at least perhaps reach their level. And that's the only yardstick I have to compare. We haven't done some analysis. Now, in 20 years, will we be at 70%? It's conceivable in certain segments. I don't see why not. I really just see value of consult and resistance to adoption being the only barriers. And I think, I think if we had to guess, at least in South Africa, if you have access to a provider, my heuristic would be about half the people still want to see someone in the flesh. But that trend is going to decline every year, won't it? So the winds are blowing in our favor, for sure.
This is really good. I mean, voting with your feet is okay when we shop right and, shop right and Carrefour and those kind of things. But when it comes to healthcare, I think the doctors have such an influence on making their patients vote, come and see me. There's that connection no matter where you are in the world. So if we do get healthcare providers on board, I think you're right. Insurance, everybody will follow. But if the incentive is for in-flesh consultation, then guess what the healthcare providers are going to do? It's a tricky balance, but I really like the conversation. Let me move to Margaret because, yours was truly quite obvious that this is not a new technology like Brian said. And being the final panelist, why don't you give us your parting shots? We've learned a lot. I've certainly learned so much on this. Let me hear your parting shots and what's your take-home message for the attendees. Margaret, over to you.
Yeah, well, my first take-home message is there's a lot more we have in common than we have different. I've taken something from everybody's presentation and from the questions that were being asked. So I think we share some of the same challenges, and I think we need to, work together to sort of share our experience about solutions. I suppose one of my take-home sort of points is, it's not about the technology per se, as we know. I mean, some of the technology has been around for a long time. It's continuing to improve and be much more accessible. So it's about creating the conditions for how we can facilitate, as I say, that adoption from clinicians and staff and from our citizens. I think COVID has brought a different lens to this because we had such a significant disruption of our normal service pathways that people had to resort to doing things more virtually. We did an interesting public consultation last summer and really worked very hard to get views for people who weren't online as well as people who were able to respond online. So we got about 5,000 responses, which is pretty good for a public consultation on people's attitudes to video consulting as an example. And we had something like almost 90% of people said that they felt video consulting should be an option for people for accessing health and care services. And the figure for clinicians was much higher. And some of the barriers were around having access to the right technology, having the right space to do a consultation. And I think from the clinician's point of view, it's more about, in Scotland, we don't have the issue about incentive from payment. So healthcare is free at the point of delivery. There isn't a national sort of insurance system other than the one that the government provides that we all pay into. So we don't have those levers. But I think there's still the issues of culture and of people resorting to, we've always done it this way, therefore we'll continue to do it this way. And when we were looking at the implementation of our video consulting, we had sort of three pillars. We had the technology, so needed to make sure the the clinicians had the right devices and, were able to use it. We had the service redesigned bit. So how do you redesign the pathway to enable the technology to be used to optimum effect? So it's not just about plugging something in and saying off we go. There are some changes you need to make to that sort of pathway. And then the third pillar is around the skills and the leadership. So I think we need to invest and focus on all three aspects. At our peril, we focus only on the technology. So I think we need to look at technologies being the enabler, not the end in itself, and keep our real focus on those outcomes that we're aiming to achieve. And if we can draw out the evidence that we are improving access, that we're reducing inequalities, that it's not going to be an option for everybody. So we need to have a range of options open. But in Scotland, our incoming government, who was elected just a week or so ago, they have a commitment that video consultings will be a default option where it's appropriate. And obviously for both the citizen and the type of service. And that's a really strong authorizing environment that we would never have had, I think, a few years ago. So as I say, I think we need to work across that whole system. I think we've huge opportunities. And again, the point I made in my presentation, I'd like to iterate again, is digital inclusion. We do have to ensure that we're not leaving people behind. And as we open up more digital channels and opportunities, that we really actively support our citizens to be able to access those. And we have a big program in Scotland underway aiming to address that. Happy to share that sort of the learning from that with people as we develop. But I do think we have to keep that as a big focus as we move forward.
Thank you, Margaret. That's for sure. We have to keep learning. I think sharing is another great thing. So when we talked about action, I think Brian will need to create a platform, some kind of a process to keep the conversation going. I'm sure we'll craft that. But this is a good time to bring in Bakari Nyari. Bakari, I've certainly learned so much, and I've seen these experts from the panel on the ground tell us what's happening in Africa and Europe. And as the champion at Africa Union, Bakari, let's hear your reflections on this fantastic 75 minutes, 80 minutes we've had. Bakari, over to you.
Okay, thank you very much. So AUC is a policy organ, and we are committed to create the enable environment to ensure the smooth implementation of telehealth projects through the development of the digital health strategy. So currently, we've started working on the strategy, and we are hoping to have it finalized. It's a continental digital health strategy. We are hoping to have it finalized by the end of the year. Okay. So far, member states have shown commitment and they are interested in it. We formed a task force, and the task force is comprised of people, representatives from the private sector, from the regional economic community REX, and from some member states. So AUC is truly committed in creating the enable environment for the smooth implementation of telehealth and digital health strategies in the continent.
Thank you. This is so good for other members who are not in Africa. RECs means regional economic communities like East Africa, West Africa. So Bakari, thanks for bringing them on. Thanks for bringing private sector actually in your group. We will be very happy to make sure we recommend the right people, and also member states. For the other people, it means countries. So you're ensuring all the countries are on board. And I think this strategy, if it receives head of state approval, which I'm sure you'll get, I think then the ministries of health will accelerate all those barriers that we've been talking about. So thanks for sharing that. We will keep a track of that strategy. I want to invite Brian to give us a 2-minute, 3-minute roundup, and then I will come towards the closures and thanks from all the team members that have been involved. So Brian, over to you.
Thank you, Ahmed. Just to say to you that, again, reading through the questions and relating them to this Q&A conversation, it's, if I can put it like this, it's blindingly obvious that we cannot just have this as a one-off event. It is clear to me, even sitting now, as I look at the faces on the screen and look at the list of participants, I realize there are already collaborations which should be happening. And if you take it from a government to government point of view, Scotland into some of the countries in Africa, I even taking that as an example, and the stuff from Belgium into Africa. And by the way, a point I'll always make is it's very important that people in Africa realize, of course, you got a great market. Of course, you got to develop it. But don't forget, there's a market outside of Africa as well.
Mm-hmm.
And I always make this point of, it's a two-way thing, this. This is not Europe coming to Africa. This is Africa coming to Europe as well. Some of the frugal innovation I've seen in Africa, I tell you, you do things there at a price that Europe would never, ever be able to achieve, because we're so well developed, as they call it, that we tend to spend a lot more money than is necessary sometimes on developing innovation. So just as a general thought, look upon this as a two-way thing. Look upon this as, we already have a methodology. We set up the partnership with the federations so that we don't have to reinvent the wheel. We exist. So as Amit says, we will craft some way for all of us to keep in contact, because often we come to these and we say, oh, I must remember to call that guy, or what was that guy's name? So you will be getting a recording, etc., of all of this. But please do feel free to connect with each other or connect with the federation and ourselves. This is the beginning, not the end. And it's a long journey, and we need lots of people on the journey with us. So thanks to you all.
Fantastic. To add to what Brian has said, look, we have your emails, and we have a wider ecosystem that will grow. So when the email comes to you as a report, feel free to reply and say you're interested in a platform or the continuity. And as Brian says, as we carve out the structure, we might have a follow-up, and we will have a follow-up, we will have a follow-up session to keep it going. We've got very nice AU support. We've got EU support. Now, what more do we want? And now we've got the private sector. I do want the members of this team to switch on their cameras, and I do want to bring in Myra to give us some wrap-up and forwards. The people that you see now coming on stage are people who have been really the key stars of the show, who've been able to put all of us here. So I do thank them and salute them. All of you have been excellent. The work now begins, as you know, after the event, but we've got 6 minutes to go. Myra, over to you to take us through the end.
Thank you so much, Amit. I will not take all of the 6 minutes, but what I wanted to do is just sincerely appreciate everyone who is on this forum at the moment. The ECH Alliance and the Africa Healthcare Federation synergy has come out latently. It's extremely exciting. We have the same vision, and we want to see both continents merge into, and I really appreciate what Brian said about reverse trade missions.
Mm-hmm.
We have a lot to give, south to north. We're always talking about north to south. Let's talk about south to north. And really excited to see where this is going to go. That it's the first of its kind when it comes to a series of health-based summits that we're going to be having. I really want to appreciate the participants for being here and sticking it through the whole session, the wonderful question and answers that have given us some sort of direction on what it is that we need to be focusing on for the continent, both for the private and public sectors. And absolutely the panelists with their wealth of knowledge that they've brought to the table and the experience that they've had in both continents, and how we can synergize and make sure that we maximize on these opportunities and potentials. So thank you so much, everyone, for being here.
And thank you to all the team members. And Myra, thanks for coordinating with all the panelists. Heather, if you can wave, I want to see you, because you've been also very good in setting the whole platform with ECHA. Thank you, Valentina. If you can just wave. And thank you, Beatrice, for ensuring that we get the right corporates on board. Lauren from Zambia, if you can show us, wave there for your coordination. Joel, who's also from Nairobi. And Andy, where are you based? Where's Andy based?
I'm in England.
Okay, there you go. Andy's in England. So all these team members, I want to thank Dr. Mohamed El Sahili from Zambia, who's also director on the board of Africa Healthcare Federation, who's joined us for this session. Linda Decker from Ghana. Dr. Lilian Kochola from Kenya. These are all key members. I can recognize them. They are on the attendee list. And I'm sure, Brian, you're recognizing some key people from
Yeah.
Europe who've also logged on. So I think it matters. And this topic matters. And I think the panels have done a super job. We are at the closing stage. Brian, do you want to make any more remarks before we give
Only
2 more
just in the
minutes to
sense
people?
only just to say this, that this, as you know, has been recorded. Valentina has got the wonderful job of producing a report, for want of a better term. So good luck with that, Valentina. Happy to help on that. But I think there's so much content, I think, that we can come up with a summary report. The point of all of this is not to finish here, but to actually begin the journey, as I keep saying. So when the report comes out and we distribute it to all of you, you will have follow-up emails. Don't ignore them. Join us on the journey, because I think it might be beneficial both from your own business point of view, but also just because we need to do this on behalf of all of our missions, which is to improve people's healthcare wherever they are. And we have a big job to do.